Hi, everyone. My name is Yehoshua Bloomstein. For my presentation, I decided to look at confidentiality and secrets in family counseling. I chose this topic because I think confidentiality is one of those things that seems pretty straightforward when we're talking about individual therapy. But once you add multiple family members into the room, it becomes much more complicated very quickly. Now, as counselors, we're taught from the very beginning that confidentiality is one of the foundations of the therapeutic relationship. Clients need to know that they can trust us, and they need to feel safe enough to share difficult thoughts, feelings, and experiences. Without that trust, therapy doesn't really work. But family therapy presents a unique challenge because there isn't always just one client. Sometimes we're seeing a couple, sometimes we're seeing parents and children, sometimes we conceptualize the family itself as the client. That raises an important question. If one family member tells us something privately and asks us not to share it, who exactly are we protecting? Are we protecting the individual who disclosed the information? Are we protecting the integrity of the family system? Are we protecting the therapeutic alliance with everyone? I think these are difficult questions. I don't think there are always perfect answers, and that's partly why I was drawn to this topic. Throughout this presentation, I'll talk about why this issue matters, what our ethical codes say, what New York regulations say, and then I'll walk through a realistic scenario and discuss two possible ways a therapist could potentially respond. Okay, so before getting into the details, I just want to briefly talk about what I hope we'll take away from this presentation. First, I want us to understand why confidentiality becomes particularly challenging in the family counseling setting. I think many ethical dilemmas arise not because therapists want to do something wrong, but because they're trying to balance multiple good things at once. In this case, those things include trust, transparency, honesty, client autonomy, and protecting relationships. Second, I want to review some of the ethical guidance that we actually have available to us. We don't have to make these decisions completely on our own. We have the ACA Code of Ethics, the NBCC Code of Ethics, supervision consultation, textbooks like the one that we're using, Gladding, and state regulations that can help us think through these situations. Third, I want us to think practically. Ethical discussions can sometimes stay in the level of theory, but in the therapy room, clients don't present us with textbook examples. They present us with messy situations involving fear, shame, secrets, and competing loyalties. So, by the end of the presentation, I hope you'll have a sense of how you might begin navigating one of these situations if it came up in your own practice. I don't necessarily expect everyone to agree on the exact same course of action. In fact, I think part of being an ethical therapist is recognizing that reasonable professionals can sometimes disagree. My goal is simply to demonstrate a thoughtful process for making these decisions. So, why should we care about confidentiality in family counseling? So, I think the short answer is because the stakes can be pretty high. Families often come to therapy during periods of significant distress. There may already be mistrust, poor communication, unresolved hurts, emotional distance, maybe substance use, affairs, financial problems, or parenting disagreements. Therapy is supposed to be a place where people can begin addressing those issues honestly and safely. But imagine being a family member who discovers 6 months into therapy that the therapist knew something important all along and never disclosed it. Even if the therapist had good intentions, that family member may feel betrayed, manipulated, or even deceived. They might begin wondering whether the therapist has taken sides. They may question whether therapy was ever truly an honest process. On the other hand, imagine being a client who finally worked up the courage to disclose something deeply painful, only to have the therapist immediately reveal it to the rest of the family. That person might feel exposed, shamed, or unsafe. They may never trust therapy again. So we're caught in a tension. On one side is the importance of protecting confidentiality and honoring individual disclosures. On the other side is the importance of maintaining trust within the family system and avoiding becoming the keeper of secrets that may perpetuate dysfunction. I think this issue presents several potential harms. First, there's a risk of damaging the therapeutic alliance. Second, Therapists can become triangulated into family dynamics, which may undermine neutrality. Third, poor handling of confidentiality can lead to ethical complaints, legal concerns, or premature termination from therapy. And ultimately, I think the reason we should care is because confidentiality isn't simply a legal requirement. It's deeply connected to how safe people feel in relationships, and family therapy is fundamentally about relationships. So, one of the things that struck me as I started reading about this topic is that family therapy really asks us to think about um, who our client really is. So, in individual therapy, it's fairly straightforward. The person sitting across from me is my client. My obligation is primarily to them. But in family therapy, things become much less clear. Is the client the child who is referred to by the school? Is it the parents? Is it the marriage? Is it the family system itself? Different therapists and different models might answer that question somewhat differently. Family therapists also encounter situations that individual therapists rarely have to deal with. Family members may text a therapist between sessions. A spouse may ask for a private phone call. Parents may ask for information about their teenager. Teenagers may disclose something and beg the therapist not to tell their parents. In addition, families already have patterns that developed long before they entered therapy. Some families avoid conflict, some communicate indirectly, some triangulate, some carried secrets for years. As therapists, we have to be careful not to become absorbed into those existing patterns. If we start holding secrets for one person, we may unintentionally become aligned with them. That doesn't necessarily mean we're trying to do harm, but it can change the dynamics in the room. I think one of the biggest challenges in family therapy is learning how to maintain trust with everyone simultaneously. That takes thoughtfulness, transparency, and often consultation with supervisors or colleagues. As I went back through our textbook, I noticed that Glading really emphasizes informed consent from the very beginning of treatment. One thing I appreciate about Glading is that he doesn't present ethics as simply memorizing codes. Instead, he talks about ethical practice as something that therapists actively think about throughout treatment. He discusses the importance of clarifying expectations at intake. That means talking about confidentiality before problems arise. For example, some therapists explain that they operate with a no secrets policy. They might say something like, if you tell me something privately that significantly impacts our work together, I will work with you towards sharing it with the family. Other therapists take a different approach and may agree to hold some private information temporarily. I found it interesting that Glading doesn't insist there is only one right answer. Instead, he seems to suggest that whatever approach we use should be clearly explained, documented, and consistently applied. I think that's really helpful because therapists are going to have different philosophies, but clients deserve to understand those philosophies before difficult situations occur. Waiting until after someone discloses a major secret is probably too late. Next, I wanted to look at what the ACA Code of Ethics actually says. I think one misconception students sometimes have is expecting the ACA Code to give us a step by step answer to every situation. In reality, the code provides us with principles and guidelines that help us through problems. ACA Standard A2 discusses informed consent. Therapists are expected to explain the counseling relationship, including its limitations. Standard B4 specifically addresses couples and families. It reminds us, counselors, to clearly discuss confidentiality issues and explain how information obtained in treatment will be handled. What stood out to me is that the ACA doesn't say therapists must always disclose secrets. It also doesn't say therapists must always keep secrets. Instead, it emphasizes that therapists should establish policies ahead of time and make sure everyone understands them. I actually appreciate that because therapy is messy. Human relationships are messy. Ethical codes can't predict every possible scenario, but they can encourage us to think carefully and avoid making impulsive decisions. The NBCC code complements the ACA code in several ways. The NBCC emphasizes protecting client welfare, practicing within ethical boundaries, and obtaining informed consent. Something I found interesting while reviewing the NBCC code is that it places a strong emphasis on transparency and professional judgment. Therapists are expected to anticipate ethical problems whenever possible. That means we shouldn't simply react when a secret suddenly appears. Ideally, we should already have thought through our approach. We should know what our ethical policies are. We should have discussed them with the clients. And if something unexpected arises, consultation is encouraged. I think this is reassuring. Sometimes newer therapists feel pressure to immediately know the answer, but ethics isn't always about having an instant answer. Sometimes ethical practice looks like slowing down, consulting, documenting, and reflecting. Since I plan to get licensed in New York, I wanted to briefly look at the state regulations as well. New York expects licensed mental health professionals to protect confidential client information, except in circumstances permitted or even required by law. Examples might include imminent risk of harm, abuse reporting requirements, court orders, or other legally mandated disclosures. However, New York regulations don't provide detailed instructions for every situation involving family secrets. That leaves therapists with professional discretion. This is where our ethical codes, supervision, consultation, and clinical judgment become especially important. I think that's both empowering and also could be intimidating. It means therapists have flexibility, but it also means we carry responsibility. We have to be able to justify our decisions and explain how they were made. So, I wanted to come up with a scenario that felt at least somewhat realistic. Let's imagine a family consisting of Mark and Lisa and their 13 and 14-year-old son and daughter. They've been attending family therapy for quite some time now. They're discussing communication difficulties and increasing tension at home. One evening, Mark emails the therapist. In that email, he basically tells the therapist that he's ashamed, but he's recently relapsed with alcohol. He's afraid his wife will leave him, and he's worried that his kids will lose respect for him. He begs the therapist not to tell anyone. Please don't say anything. I just needed someone to know. I promise I'll handle it. The next family session arrives. Lisa says, something feels off. I feel like you're keeping something from me. At that moment, the therapist is sitting with information that directly affects the family, but was shared privately. This is exactly the type of ethical dilemma that does not have an easy answer. Okay, so when I was thinking about this situation, I realized that one of the biggest mistakes I would make as a therapist is feeling pressure to have an immediate answer. Because ethics doesn't usually work that way. Most of the time, ethical practice involves slowing down and intentionally working through a decision-making process. The first question I would ask myself is, what exactly is the ethical issue here? In this case, the issue isn't simply confidentiality. It's confidentiality within a family system where the therapist has responsibilities to multiple people whose interests may or may not completely align. The second question I would ask is, what ethical standards apply? At this point, I would review the ACA code, the NBCC code, my informed consent paperwork, and the policies regarding secrets in family therapy. I would also think about whether there are any legal obligations that might require disclosure. In this case, because Mark's relapse does not appear to involve imminent danger, abuse, or a legal reporting requirement, there is likely some room for clinical judgment. The next step would be consultation. I think consultation is one of the most underappreciated aspects of ethical practice. We don't have to figure everything out on our own. I would probably talk with a supervisor or trusted colleague and think carefully about the potential consequences of each course of action. Finally, I would consider what decision is most likely to preserve trust, maintain the therapeutic alliance, and promote the long-term well-being of the family system. I don't think ethics is simply about avoiding complaints. It's really about helping people while remaining transparent and accountable in our decision making. Okay, so getting more practical, the first possible solution would involve operating from a no secrets policy. Under this approach, the therapist would remind Mark that family therapy was entered into with the understanding that information directly relevant to the family process would not be held indefinitely as a private secret. I want to be clear that I don't think this means immediately walking into the next session and saying, Mark relapsed. That would probably feel shaming, abrupt, and damaging to the therapeutic alliance. Instead, I think the therapist would meet privately with Mark and say something like, I really appreciate that you trusted me enough to share this. I can hear how much fear and shame you're carrying around this relapse. At the same time, because this impacts the family, and because we're doing family therapy together, I don't think it's something I can ethically hold forever. What I'd like to do is work with you so we can find a way to share this in a manner that feels supportive and respectful. The advantages of this approach are pretty significant. It maintains transparency. It protects the therapist from becoming triangulated. into the family dynamics, and it also models honesty and accountability, which may actually strengthen family relationships in the long run. Of course, there are drawbacks. Mark might feel betrayed. He might become angry and decide to terminate therapy. He may be less willing to disclose sensitive information in the future. So, while this approach has many strengths, it also definitely carries some risks. A second possible solution would be to temporarily maintain confidentiality while continuing to work with Mark. Under this approach, the therapist might decide not to disclose the information immediately. Instead, the therapist could spend several sessions helping Mark process his shame, his fear, and his anxiety about disclosure. The therapist might ask questions such as, what do you might imagine your wife would say if she knew? What would it mean about you as a husband and a father if they found out? What are you most afraid of losing? The therapist could continue encouraging Mark toward disclosure while consulting with colleagues and documenting the clinical reasoning process. I think the advantage of this approach is that it demonstrates compassion. It recognizes that people often disclose difficult information because they finally feel safe enough to do so. However, I think this approach has some significant risks as well. The longer the therapist holds the secret, the more likely it becomes that the therapist will feel caught between loyalties. If Lisa later discovers that the therapist knew about the relapse for months, she may feel deeply betrayed not only by her husband, but by the therapist as well. In some ways, maintaining secrecy can unintentionally recreate the very relational patterns that brought families into therapy in the first place. As I reflected on this dilemma, I found myself leaning toward the no secrets approach. I think part of the reason is that I conceptualize family therapy as treatment for the family system rather than treatment for isolated individuals. If I know something significant that directly impacts the family's functioning and I hold on to that information indefinitely, I worry that I stop being a facilitator of honest communication and begin functioning more as the keeper of secrets. I also think about what I would want if I were sitting in Lisa's chair. If I learned 6 months later that my therapist knew about a relapse and never addressed it, I imagine I would have a very difficult time trusting that therapist moving forward. At the same time, I don't want to dismiss Mark's experience. Relapse often comes with tremendous shame, guilt, and fear. I think a therapist's job is not to force disclosure, but to help create enough safety that disclosure becomes possible. So, my preference would be to establish a no secrets policy from the very beginning of treatment and then work collaboratively with clients when difficult situations arise. I think that strikes the best balance between compassion, transparency, and maintaining trust within the family system. One of the biggest things I learned while preparing this presentation is that ethical dilemmas rarely have a perfect solution. Often we're balancing multiple important values at the same time. We want clients to feel safe. We want family members to trust us. We want to respect autonomy. We want to avoid harm. Family counseling is particularly challenging because every decision affects multiple people simultaneously. I think this presentation reminded me that ethics is not simply about memorizing codes. Ethical practice involves reflection, consultation, humility, and a willingness to slow down when situations become complicated. It also reminded me of the importance of informed consent. Many ethical problems can be reduced, not eliminated, but reduced, by having clear conversations at the beginning of therapy about expectations surrounding confidentiality and secrets. Ultimately, I think ethical family therapists strive to remain transparent, thoughtful, and intentional while helping families move toward greater honesty and connection. As I said earlier, to me, the no secrets policy is what I lean towards. But again, it will only work if it's something that's said up front. So that informed consent that we start with, again, is of utmost importance. Ultimately, the no secrets policy, the goal is not exposure. The goal is therapeutic honesty and an alliance with all the people involved. I'm going to conclude by just thanking everyone for listening. I found this topic surprisingly interesting because it highlighted how ethics often intersects with human experiences such as shame, fear, trust, and relationships. On this last slide, you'll find the references and some of the sources that I used in preparing this presentation. I'm looking forward to hearing everyone's thoughts and discussing whether you would have approached the scenario similarly or differently.